What is going on, guys? Welcome back to the Nutrition Blueprint podcast. Super excited to have, I guess you've probably heard it on the introduction a little bit earlier, but I get the chance to have not only a great healthcare professional that is up and coming in his virtual physical therapy practice, but at the same time, a client of mine, a former client of mine who we worked together for how long? 12 months, a year?
Close to it, yeah.
Close
Yeah.
to a year, man. So we can probably dive a little into that now that I think about it. But Corey, dude, welcome to the show. How's it going, man?
Yeah, thank you, Andres. Thank you guys for having me. I really appreciate it. And it's funny looking back as a client. I was like listening to the podcast every week, and I was like, I think it'd be awesome to actually kind of get on there and get into it a little bit and kind of be one of the success stories. Being one of the
Yeah,
clients
dude.
that you had.
And that's exactly what I thought. It would be pretty cool to kind of bring you on, because not only were you a former client, but at the same time you're like I said, like, getting into like the entrepreneurship kind of world, and but it's specifically to this area of, like, physical therapy, like, all these different kinds of areas that it's really interesting for me to see now that it's like going into the direction of virtual, which is pretty awesome. Like, I guess in this like COVID era that we kind of live in today. So I've seen that a lot happening. So I have a lot of questions to dive deeper into that. But before we get into that, dude, what's your story? I love to kind of like talk to people and get people to kind of share exactly where they came from, kind of what got them to where they're at today. So where did it all start for you?
Right. So, obviously, I'm a licensed physical therapist and a certified strength and conditioning coach. And people usually get injured, right? And then they go through physical therapy, and that's why they want to become a physical therapist. I was kind of on the opposite end of the spectrum. I actually worked as a strength coach and a personal trainer kind of throughout college. And actually, after college, when I took 2 years off before going to grad school for PT. And there I worked with a lot of people who were injured, usually as basketball and hockey athletes, and I would help create rehab programs with their athletic training staff. And that's where I really like learn how to like modify exercises. I'm really throw in corrective things to do. Rather than teaching people like the wrong way to do things, or people with improper form getting hurt over and over again. I kind of like to kind of assess their form, like watch these things and then go in and kind of help improve them. Um, so kind of did that. And then I was like, I really like creating rehab programs. I really like helping people get back on the field. I don't enjoy like screaming at people, at the top of my lungs, like 80 hours a week for very, very low pay. I mean, you can make good money as a strength coach. You just have to know people and climb the chain. So it takes a lot of hard work. And I'm not saying physical therapy doesn't either, but that's just kind of the truth in the matter. So I went to grad school, became a physical therapist, worked in an outpatient clinic for the past 3 to 4 years, I'd say. And I've done some home care on the side, going to people in person. And I loved it and everything. And I learned a ton, met a ton of people, treated people from as young as like 5 to 6 years old to about 90 to 100 years old. So it's kind of a nice kind of, variety of patients to see and treat, and a variety of diagnoses. But at the same time, I just got sick and tired of like the way the healthcare field is run. At some days I would see 20 to 30 people a day and wouldn't even have time to like eat lunch or a snack. Right. And it's hard to keep up with 20 to 30 people a day because these cases can be so complex. And by Friday, you're just exhausted and drained. Right. So, what happened is during COVID, we actually shut down the clinic for 2 months. And I'm like, I'm not just going to sit home without pay and, just like sit on my ass. Right. I'm going to get out there and do something different. So I created a side hustle, made my own business. It's called Hoffner PTSD, which stands for physical therapy and strength and conditioning, where I offered virtual PT, to people who are interested in it and want to get into it. And that's really taken off since COVID. And it's really, I'm a big kind of component or fan of exercise. So I'm a very manual exercise based therapist. I do manual therapy with certain patients. We can get into that in a little bit. But really, what happened is that kind of virtual component just took off, like I said. And then I ended up kind of leaving my job actually 3 weeks ago, and I went full in on a business. So now I do virtual and a little bit of mobile PT if you're in the area of
Nice.
Connecticut where I currently live.
That's so exciting, dude. I have so many different questions I want to go into. So we're gonna go on the first one. You mentioned something that you kind of got sick and tired of, like the way that the healthcare industry kind of like is ran. And it's funny because I was having a conversation with my wife yesterday about how doctors typically because she wants to kind of see an OBGYN or something. And doctors typically see anywhere between like 10 to like, I think it's like something like 8 to 10 like clients or 10 to 10 patients per hour.
Yeah.
So like, and it's crazy to think about it that like, from that perspective, because that's the way that they can actually make their money from, because it's like through insurance versus now, like there's like this doctor in Miami or so, like he's now like private pay only, and he sees like one client per hour, right? Kind of like that we do it. So why don't you like maybe like you maybe elaborate more about those kind of like frustrations? And I'm guessing you were working in an insurance based type of
Yeah.
clinic that it was, what do you think is the biggest problem that exists around this?
Yeah, no, great question. I'm glad you asked. I didn't know how in detailed you wanted me to get, but for sure it was insurance based, right? So, you come in, people fill out the paperwork, they have like a $20 to $50 copay. They're typically there for 45 to 60 minutes, right? So every 30 minutes you have a new patient coming in, right? So if you're working an 8-hour day, that's what, 16 patients in total, right? And that's without like taking a lunch or anything like that. But a lot of times you're not working 8-hour day, you're working a 10 or 12-hour day. So you're
Yep.
seeing, like I said, more so closer to like 20 to 30 people, maybe 24 on a 12-hour day.
And is that what's
And again,
optimal for PT though? Like, or like what would be the ideal world for you? Like, having a full hour with somebody, or like what's
yeah,
realistic in terms of that?
yeah. So that's what I'm kind of getting to. So that's the reason why I wanted to leave the model, right? Because it's everyone burns out. No matter who you are, you're going to burn out. It's hard to just keep a check on yourself, right? Let alone 24 to 30 people a day. Um, so ideally for me, the whole process of me starting this business, right, Hoffner PTSD, and kind of growing online is to actually open a brick and mortar, hopefully next year, and do private cash-based PT one-on-one, where I'm seeing 7, 8 people a day, right, where I get them for a full hour of treatment. Because like what I found, even virtual PT, is if they get more of my time and I can kind of help them with certain exercises and form, right, posture, all the above, then they get better in half the amount of time, right? And they might spend like a little bit more money in the short term, but in the long run, they're probably spending less money because they don't have to keep spending all these copays over the course of like 3 to 4 months. And no one
Okay.
sees it as that. Everyone wants the overnight fix.
That
Um,
makes perfect sense. Yeah, that's interesting because
but
that
yeah,
was
that's
like, I mean, no, because when I think about it, it's like, if I've never actually practiced as a dietitian, that it's like insurance based, but I think that the way that they practice is based on like 50-minute increments. So to me, it's like I'd never actually try to restrict, like, and when we work together, like sometimes like okay, like we times go over, I'm not gonna be like, hey, sorry, times is up. But it's more like, hey, I just want to make sure that we kind of get across obviously this kind of information that we need to kind of go over. So I feel like a lot of times like insurance companies, or like the way that typically healthcare businesses or healthcare it's kind of run in here, it doesn't allow for like full on like proper care of clients. And this, I see this a lot in doctors, because it's like you go in a doctor's office and it's like you're just waiting in there around, like they have like 3 different nurses that come and actually do like literally 75% of what the doctor does. And then when the doctor comes in, he sees you, he's like, okay, you're fine, like it's really nothing a big deal, prescribes something, and then walks out in like 10 minutes. So
yeah.
like it doesn't feel like something personal, it doesn't feel something, so it's just like you're another number into like they're basically their tally for the day.
Exactly. And that's the insurance game, right? Doctors are seeing like, I've had many conversations with doctors, especially now because I'm marketing more. Like you said, they're seeing probably 10 to 12 people an hour, which is crazy, right? They're bouncing from room to room. So, they maybe they look at you, they assess you. If you're lucky, they might touch you like where it hurts, right? Or palpate.
Yeah.
But a lot of times they don't even have time to do that, right? They're coming in and they're leaving. And
Yeah.
the insurance-based model is all about get them in, get them out.
Yeah.
And in PT, it's 30-minute sessions with a client. So typically they're there for an hour. So you can have 2 or 3 patients at once. And that's where you have physical therapy aides who come into play. And those are usually either grad students or college students in school who don't have a lot of knowledge or background, but they're there to kind of help patients with exercises, which is another scary scenario because there's been cases where like they've shown patients wrong ways to do things and it's set them back or they've gotten injured more from doing that. And that's another reason of why I like wanted to get out of that model as well.
Okay, that makes sense. Now, switching gears more into now this virtual like physical therapy model. Like, to be honest, when I first heard about it, I was like, okay, but physical therapy is like, as a dietitian, okay, I just talk to people. There's nothing really kind of hands-on. So how does that work? How does it work to actually provide physical therapy in a virtual environment? I'm sure there's some things that you're limited doing, like what you mentioned, you want to have this idea to have like an actual brick and mortar type of business. But when we start to think about more like the virtual kind of like way of doing things, what does that look like?
Yeah, no, good question. So people hear virtual and they're like, they take a step back. They're like, I don't know if I want to do that, especially if they've been to physical therapy before in person, right? Every therapy place is different too, so that's something to keep in mind. Like some therapy places are old school; they'll do ultrasound, right, with the gel. They'll do heat. They'll do electrical stim. They'll do all three of those things, no matter what your diagnosis is, and that really shouldn't be the case. Because those things don't have a lot of research to support them. But with virtual PT, I think it works so well because with COVID and everything being so crazy, people's schedules have changed a ton, right? So a lot of them like were canceling their PT appointments. They have kids in different schools who were some are remote, right? Some are in school. So their schedules are so crazy they haven't been able to come, making them inconsistent with showing up for their appointments, right? Getting them further away from their goals. So through doing virtual PT, we're able to get more consistent of the schedule going, right? I'm able to hold them accountable by doing a weekly check-in with them. And then I'm able to ask different questions, like I know you do too, about like mindset, right? Nutrition, and all these other things like sleep that don't get addressed in PT, right? Where you're just a number and they're maybe assessing you have a shoulder issue, they're assessing your shoulder, maybe your neck if you're lucky, or something else you have going on.
Yeah.
But we kind of take a global approach on things with virtual PT, and it's worked like really well that way. And people are held accountable to do their exercises because they get accountability through me from Monday to Friday, excuse me, throughout the week.
And does that look like in terms of like specific kinds of movements and like prehab type of like routines and different things like that you kind of get them to do based on their areas of work? And is that kind of what the main outline looks like in terms of like working with them?
Yeah, yeah. So it's different for everybody, right? I would say virtual isn't for every single patient, right? Just like probably nutrition online isn't for every single person. If someone is post-op, right, they had a rotator cuff tear or something like that, they need to go see a physical therapist in person because they need them to passively range them and work their shoulder through motion because they're in that protection phase where they can't really do any exercise yet, besides some simple little
Yeah.
things. Right. But if you're someone with like a tendonitis, like say you have tennis elbow or golfer's elbow, you're a perfect candidate for kind of virtual PT. And I'm going to show you exercises, maybe some soft tissue techniques you can do, give you some educational background on it. And then again, fill in all that foundational stuff kind of around it, right? Mindset, meditation, sleeping, to help kind of further reinforce things.
Okay.
Um, but does that
No,
make
yeah, it
sense?
does. It does. It does. That's kind of great. It's just kind of like all new to me. So I'm just kind of like learning a ton about this and in terms of obviously how it works.
Mhm.
So that's great. So now we get into, and I guess another question is like a lot of times like people think of like physical therapy as like after the fact type of thing. Is that like, do we see, do people typically have the wrong notion around physical therapy as a more of a after the fact, meaning like, okay, I hurt myself, so now I got to see physical therapist. Like, for example, last week I did have an issue like at a CrossFit gym. I do CrossFit, the CrossFit gym that I go to. They have this like physical therapy therapist that actually kind of does some stuff in there that is kind of like complementary sometimes. So essentially I had a knee issue. So like I typically will not go see a physical therapist, which is a problem. And I think I need to change that until I have a problem. So what is your stand on that? Like what do you typically tell people? Like you need to do this as a preventive measure and there's some things obviously that you work through people with. Or is it more like, okay, when you hurt something, then just kind of come and see me pretty much?
Yeah, yeah. I think the old school mentality is like exactly what you're explaining, right? It's like, don't go see someone, don't go see the doctor, don't go see a therapist until like you really can't walk or something like that, right?
Yeah.
It's changing a little bit now that there's more education and more background information around everything. But I've done some seminars at like CrossFit gyms, probably like one you're explaining. I actually do like complimentary like postural screens or movement assessments there too. And I'm starting to kind of teach them like how to do a proper warm up, right? So teaching them like dynamic warm up, right? Simple stuff like leg swings, walking lunges, things that get like kind of that muscle temperature increase, so blood flow kind of increases to that area, so they're less prone to injuring themselves. And then really trying to incorporate them into doing static stretching at the end of the workout,
Okay.
because that helps prevent injury and helps prevent soreness as well. Um, but yeah, I would say people are getting kind of more used to kind of seeing, well, typically they'll see the doctor first, right? Then they'll prescribe them to go see therapy
Yeah.
through a script.
Okay.
Um,
That
but
makes
it's
sense.
different for everybody.
Okay, cool, interesting. Now let's get into, because like you mentioned CrossFit, you do a few different kind of seminars and different things like that. I do CrossFit, you know that. So and that's definitely something I've been doing for like the past 6 years. I just love the way I just simply go. There's like a workout prescribed. There's a time domain. There's like all these different things like that. So, and for a lot of people in the audience that typically listen to this podcast, they may also be involved in this type of like training mode or discipline. But I also see that there's a lot of issues with it because of the fact that there's a very high intensity component. There's a heavy weight component as well. And sometimes like people are not having the proper foundation to be able to do it. And sometimes like maybe because of the fact that there's also a competitive component too, they just kind of like go in the direction of a lot of like injury issues. And I probably can comment on this on my own personal experience, from like really terrible low back pain to shoulder injuries to recently kind of like a knee injury and different things like that. So let's just maybe dive into that specific area, since I know you work a lot with this kind of people. So let's just maybe first talk about the biggest mistakes that people make when they're starting their fitness routines, particularly when they're starting something as intense as it can be CrossFit sometimes.
Yeah, no, great question. CrossFit, especially, that's the reason why I got into CrossFit, is because, I started doing it myself, kind of like 12 months ago when I started working with you, right? I got into a little more of those workouts, and just to switch things up because it's a little more exciting and more interesting to kind of
Mm-hmm.
perform. And then it's such like a tightly like knit community, which is awesome. So if you're lacking that and working out, like I'd say like join a CrossFit gym and everything's done out for you, especially if you have a coach. But getting back to your question, um, you know, pretty much, I think people rush into it, right? Some people don't work out at all. Then they'll go show up at CrossFit and they'll go from 0 to 100%, right? And that's a no-no. That means they're going to have some shoulder issues eventually and probably knee issues. Those are the two most common that I see. People are trying to overhead squat and they just don't even have full shoulder flexion, right? Meaning they can't lift their arm up over their head. And they shouldn't be kind of loading it if they can't get there without any weight. So that's where little things come in with like using like a PVC pipe or something like with little weight or maybe just body weight. Um, so that corrective like exercise I was telling you about, like that's why I do a lot of these movement screens, which help to newcomers who come to CrossFit, because then I can say, you need to do this for like a week or two before you get into actually doing the overhead lifts, right? You need to do like wall angels first. So you need to do like a pec stretch laying on your back on a foam roller to open things up, right? Because you're going to make things worse if you don't have the mobility to get there, and it's going to lead to issues, like you said, like back pain or shoulder issues. But actually, what's funny is I'm working on something right now, is like a kind of pre-CrossFit routine for people, because I'm finding that a lot of the same things keep reoccurring at the CrossFit gyms that I go to. Like a lot of people have knee pain or shoulder pain, and a lot of them lack mobility and don't do any kind of dynamic warm up or any kind of cool down. They just get in, do their Olympic lifts, very heavy lifts for high repetitions, which is fine for someone who's advanced. But someone who's a newcomer should probably do the opposite of that, right? They should do like kind of medium to intermediate weight, I'd say, for like kind of lower reps, right? They
Yeah.
shouldn't do like super high reps with that weight, at least not yet starting out. They need to kind of, progress over time. It's called progressive overload.
So when you look at when you talked about movement screens that you do as well,
Hmm.
what does that allow you to say, for example, for somebody when you're doing that, what are some of the things that you kind of like look at, from shoulder flexion, as you're mentioning? And I guess like when you look at this and you start to think about like, okay, like this is like, I like to always like, I'm very kind of practical, methodical around some of this stuff. And even when I start to think about nutrition, it's like, okay, we need to kind of put you into this bucket of people that is, okay, you have poor shoulder flexion. So these are the kind of movements that you should probably kind of stay away from. And this is the kind of things that you should probably be able to do before you kind of progress into a second kind of stage. So is that the way you kind of like look at it when you're kind of doing some of this movement screens and like, postural assessments and different things like that?
Yeah, it's different for everyone, and that's why like people like the virtual PT so much because it's all customized and individual to them, right? If someone has like shoulder impingement, right, and then another person comes in with shoulder impingement, they could have totally different symptoms and have totally different issues,
What is
right?
shoulder impingement, just for people listening in so they can?
Shoulder impingement, so it's kind of an umbrella term for like shoulder pain, but it
Okay.
could mean that you have like tendonitis of your rotator cuff. Or usually it's your supraspinatus tendon, which sits kind of right in the front of that shoulder
Yep.
there near your upper
That would
traps.
be me. Hmm.
Yeah, it could be. It's a lot of people, or it could be bicep tendonitis because your long head of your bicep tendon sits right above that. So typically, you have a lot of pain with lifting your arm up over your head when you get to about shoulder height. Then
Yeah.
it tends to disappear at the top.
Yeah.
Um, so, what do you do for things like that? You really have to strengthen the rotator cuff muscles because you have four of them in total, right? One might be strong, but the other three are probably most likely weak, right? A lot of people have a lot of people have weaker lower traps as well, just because they never strengthen them. People are very upper trap dominant, right? You see them walking around with like their
Yeah.
shoulders tugged up towards their ears, or the big guys at like LA Fitness or
Yeah.
Planet Fitness. Um, and it's just them using more so of those big bulkier muscles like their chest and their lats, and not using the small like controlling muscles that steer your shoulder joint. And that's
Okay.
probably the case with you too, right? If you're in CrossFit, you're doing compound lifts that work those big groups, but you're never really doing those accessory correctional movements. But to get back to your question, right, movement screens, I do something similar to like a functional movement screen, it's called. It's just a test created by Gray Cook, kind of way back. And he has a whole course based on this too that I did kind of right out of grad school, maybe 3 or 4 years ago. And it kind of breaks down each movement, like overhead squats, like what to do if someone can't do it or their trunk's collapsing too far forward. The breakdown brings you into exercises, right? What I find with an overhead squat is if your trunk collapses too far forward, usually people have very tight calves, meaning they're lacking a
Hmm.
motion called dorsiflexion. So I'll have them do like a lot of stretching at their ankle, and sometimes that just improves their squat form like amazingly, and immediately too.
Wow.
Sometimes people need to work on their core strength too because they're not activating their core as they're going into an overhead squat, and that's why they're collapsing forward, and that's why they're in a lot of back pain. Um, so I don't want to get too deep into the
No, no,
specifics because
but
I
this
can
is
probably
like,
talk about this all day. But
no, dude, but this is like fascinating because like I just see so many people joining in like CrossFit communities and CrossFit gyms, and I see these problems. I mean, I could see them from afar. Like, oh my God, like the guy's like kind of pushing the he's done trying to do an overhead squat, and like it's literally kind of getting on his tippy toes, like to be able to do like a full squat. Like, and then you're kind of saying like, oh, you need to kind of you have dorsiflexion issues, you have all these different things like that. It just all makes sense. And I just feel like obviously what's missing is like looking at this and doing this kind of screens and saying like, you can't do this until you do this type of thing. And I think that's usually what I probably for me has led to a lot of injuries that I kind of learned by force and not doing things correctly. Now, obviously, I feel like I've overcome a lot of those different things, but it's because of that. It's all these different kinds of issues that we don't do. We just simply kind of show up. We do like a 5-minute warm up, if anything, and then like we just go and do something very heavy, very intense, very like like in the other part too about CrossFit, it's like there's like you're doing like work under fatigue, right? So under like very elevated heart rate. So there's so much opportunities for injuries and doing movements that are not ideal, that that's usually when I kind of see a lot of this kind of problems all the time. So yeah, that makes a lot of sense.
yeah,
um
when you're fatigued, I mean, your form goes right out the window, right?
exactly.
And that's when injuries happen the most. And like, once you start to get fatigued and your form starts to go out the window, like that should be really when you're stopping your set. And in CrossFit, I know you have that whole like teamwork mentality and you don't want to stop, but like, if you're looking like, kind of crazy and wacky, like your head's all over the place and your head's over here, your body's over here, you probably shouldn't be finishing that set because you're going to pay
Yeah.
for it later on.
Yeah, I agree. Now, one of the biggest injuries that I think a lot of times, like, and I even have clients right now that are dealing with this often, is sciatica or like low back, like, typical really excruciating pain. And I think I have dealt with my fair share of that. But I even have like family history on that, or like parents, or like my dad that's kind of struggled with that in the past, like to get to a point that you can't even move. Um, Do you typically do any work around that? And if so, like what are some of the things? Because I literally was just talking to a client who told me like, hey, it's frustrating for them for them because of the fact that they're so limited on some things that they can't do. So it's like, hey, I want to exercise, but then I have all this like this big kind of problem. So do you deal with that often? And then what is that, just so people understand exactly more about what that kind of it's caused by, or anything related to that kind of area.
Yeah, I think, sciatica is probably one of the most common diagnoses I get, just from like not even CrossFit, but the generic population, right? Usually in the clinic, like I was seeing neck and back, especially after COVID, just because people were sitting at like their kitchen tables with horrible posture, or, they were sitting at like their countertops, trying to find a good spot. And they were just in these faulty postures that made things a lot worse over time. But in terms of sciatica, right? Typically, people get sciatica, right? Or I'm just kind of generalizing here, but it's the overweight person who's like a desk worker usually. They're sitting in poor posture all day, with that forward head, forward shoulders. Maybe they're leaning a little bit, putting excessive pressure usually on like their L5, so their lumbar vertebrae, and their S1 vertebrae. And that's typically the most common area, where that sciatic nerve runs through. And the sciatic nerve is one of your biggest kind of nerves in the body, and it runs all the way down your leg into your foot, all the way to the toes, right? So if you have some kind of like disc herniation or disc bulge in your lower back, or some inflammation around your spine, say you strained a muscle, like turning or rotating too quickly, and your body wasn't ready for it, you're going to have some symptoms kind of leading down into that nerve, and it could go all the way into the foot. So, what I'm doing with these patients is I'm giving them a lot of stuff to do at home, right? A lot of a lot of it involves around nerve gliding. I don't know if you ever heard of that term
No,
before.
no, what is it?
So nerve gliding just helps free up the nerve. So the nerve sits in a sheath, right? It's a synovial sheath, it's called.
Mhm.
And what happens if there's a lot of inflammation around that nerve, it can kind of get stuck in the sheath, right? Imagine like you're driving on the highway and you're in a tunnel, right? And there's a lot of cars and there's a lot of traffic. Like imagine all that kind of combustion air in that actual tunnel. That can happen to the nerves from the inflammation. So nerve gliding is a way to put the nerve on stretch, right? So to lengthen it and then to kind of shorten it, right? It's almost
Mhm.
like working a muscle. So you lengthen it and shorten it, and you do it from different ends, right? You can do it from the proximal area, from the area where it connects to the spine, and you can
Mhm.
do it from the ankle too, where it connects to the foot. Okay.
Really?
And it's a little more complex than that. I don't want to get too in detail or depth, but typically I'll work distally, so from the ankle first, and then from the knee, right, and then from the hip, and then usually the symptoms tend to resolve, right? There's something called centralization of symptoms, right, and that's really what you want. Centralization just means it's a medical term for those symptoms will move from the foot to the knee to the hip to the back. And if that's occurring, then that means what you're doing is a good thing. All right. The opposite of that is called peripheralization. And that means that the symptoms are moving from the back, going the opposite way, right? Down towards the knee, right? Towards the foot. And that's a bad thing. So if you're working out and your symptoms are kind of leaving your back and going all the way down your leg, and it's getting worse and worse, maybe traveling into your toes, that's a bad sign. That's a red flag, right? And that means you should probably see an orthopedic doctor as soon as possible, to see what's going on. And the doctor's probably going to give you like an oral steroid taper, possibly a cortisone injection to that area of the lower back, L5 and S1. And again, that's going to help, but that's typically a band-aid, right? Where it's a quick fix. It usually lasts like a week or two.
Mhm.
Some people can last up to a month or two. It just depends. It's very individual, specific. Um, and then typically you're going to the PT afterwards for that. But I'd say nerve gliding I found like works the best on those people. And then just kind of, you probably hear this a million times, but kind of keeping a strong core, that helps a lot too. So doing a lot of core activation. And I don't mean just like engage your core as you squat. I mean like isolated, like pelvic tilting, cat and camel exercises,
Mhm.
bird dogs, right? All
Yeah.
those functional type specific movements. Excuse me. I'd say really, really help. And then another big one that I started incorporating recently is diaphragmatic breathing. And I'm sure you've heard of that before,
Yep.
right? To reduce stress and everything. But they're starting to do studies that show if you're able to breathe through your diaphragm in your lower stomach, especially like while you're doing pelvic tilts and things like that, and engaging your abdominals and your pelvic floor muscles, it's shown with like a huge correlation to reduce lower back pain. So I've been,
Really?
yeah, sometimes I'll have patients just take 5 to 10 minutes today, do diaphragmatic breathing, like first thing in the morning when you're feeling really stiff or sore, or at night after a long day of work when things are acting up. And,
Yeah.
it's amazing like what it does, something that simple.
And then for people listening, for like, well, diaphragmatic breathing, which, and
Mhm.
correct me if I'm wrong, Corey, but it's basically just breathing, basically using your stomach, pretty much, right? It's like kind of like, when you're taking that breath in, it's like literally kind of like make sure that you kind of use your entire stomach and like kind of inflate it from there, from the very bottom. And then obviously, like, when you're deflating or when you're exhaling, basically it's just using your stomach also to kind of push yourself in and the breath
Yeah,
out, pretty much.
so a lot of people breathe through like their upper chest, and that's through their accessory muscles, right? Their upper traps, their scalene muscles up here, and
Hmm.
everything gets flamed up, right? So I said they walk like they have like their shoulders towards their ears. So what I do is I put a yoga block on their stomach, or I say, get a towel, put it on your stomach, and roll it up. Think about when you're inhaling, letting that stomach and that yoga block raise up, and
Yep.
inhale for 3 seconds. Right. And then when you exhale for 3 seconds and let that kind of yoga block come all the way back down towards the body.
Nice.
And usually I have them doing hook lying, which just means them laying on their back with their knees bent. That way they're
Okay.
not stressing their back as much.
Okay. Yeah. Really, really interesting.
Yeah.
Cool. This is super awesome, man. Honestly, the whole sciatica thing, like I had no idea, like all that I knew it was related to a nerve. I just didn't know exactly what it all encompassed and like what was some of the things that were done, or like even like sometimes like, okay, when it hurts from here to here, from here to here, this is some of the things that you can do. So I think that's like pretty valuable and helpful to do that. Now, when we
Hmm.
switch into now like the actual in-person physical therapy world, I know I've done my fair share of I've seen like at least like a couple of chiropractors. I've seen one physical therapist. At some point I did my ACL surgery and obviously see a physical therapist. Then there's a million different things that are done in a physical therapy office, and I feel like every single physical therapist have their own kind of ways of whether there's specifically focused on certain kinds of areas. So I've been to, for example, chiropractors that focus a lot on cupping. I've been to chiropractors that focus a lot on dry needling. Then I've been to physical therapists that do a lot of Graston techniques. And other people do just more like, they kind of teach things like, and then obviously stuff from like, the Sun Home is like foam rolling or like flossing or stuff like that. There's a lot of terms that are kind of being thrown around out there. So like maybe we don't have to go in depth into each individual one of them and how to do it and all kind of stuff like that. But perhaps like based on your experience, what you typically teach and what you're knowledgeable in, like can you walk us through some of those techniques that are being seen right now a lot in physical therapy office, chiropractor offices and such, so people understand exactly what they mean and they get educated on this?
Yeah. Yeah. Great question. I mean, we talked about that a little bit before. I mean, really, they're all like all the things you explained, like cupping, right, dry needling. They're all modalities, and they do help depending on the patient and the diagnosis. Right. Like, I used to use cupping a lot with people who have like a lot of lower back pain. And I would, use cups like around their paraspinal muscles, like on the outsides of their kind of spine. And then you can do it on their quadratus lumborum muscle too, that sits right above the butt area. And that really helps if they feel like very stiff and very locked up there, if they have a lot of muscle spasms, right? That does typically help. And usually, like, I would have them heat before to kind of increase blood flow to that area, right? So the whole purpose of like a massage, cupping, or heat, right? They all do the same thing. They all increase blood flow to the area, right? They help reduce that stiff feeling or that stiff sensation. Does it last long term? No, not really, right? It's more of a short term type thing, where it doesn't kind of fix the issue. And that's why I'm so big of a component on exercise, right? And that's why I'm so like backed by it. But I've done all those things before. Like, I'm a big proponent. I do a lot of Graston, and I think a big reason people use Graston. This is going to sound a little ridiculous, but it's just to like save our hands, right? Because you're seeing 30 people a day. If you're doing soft tissue work on 30 people a day, you're going to develop arthritis in your hands, right, or tendonitis of your elbows too. But also, it's funny using the Graston tools. You can actually get a little bit of a different feel through the actual tissue. So if you do it enough, you get good at it. You can feel like if you have a lot of scar tissue around an area, or it doesn't move as freely as like a healthy, like prosperous area. So that's a good way to use it too. But I've had people like buy these like Graston tools. You can buy like an off brand for like half the price and kind of show them how to do it themselves too, because I know that they get some relief from it. Right. So it's good to try these things if they do help patients. But if they don't, right, then there's no reason to waste time doing them. It
Okay.
depends on like what the patient believes in and what's going to help them, I think is the biggest thing and the biggest buy-in. Same thing with manipulation, right? Like we as therapists do manipulations too. And that's just a fancy term for cracking the neck, right? Cracking the back or the other joints. Um, and again, I found it's like one of those things that does help to eliminate pain immediately. But typically 2 or 3 days later, someone comes back in, they're like, I need you to, crack my neck again, crack my back, because it feels like things are out of alignment again.
Okay.
So it's a short-term fix, right? I personally like to use manipulation, then I like to do mobility exercise right after, and then I like to stabilize through doing a strengthening exercise to keep everything locked into place. And then they need to continue doing those things at home. Home exercise program is like the biggest thing that people need to focus on and do, and no one does, right? And that's
Yeah.
why like the outcomes are so bad at physical therapy a lot of the times, and
Because
why
they don't
I
do the
really
homework.
they don't do their homework. Yeah, I mean, I'm sure you've seen it too. But that's why I really like switch this virtual component, because if I'm their coach and I'm holding them accountable, they don't want to let me down, so they're going to be forced to do these things, right? Especially because they're going to be paying me a little more money, which is another incentive to them. So they're going to get better, and I find people get better in like half the time they would as if they came to see me in the clinic, which is kind of like crazy to me to think about. I'm like, I went to school for 7 years for this. Like now I'm over a computer, like helping people more than I did in person.
Yeah.
But again, that goes back to like what we talked about.
Yeah, man, that's fascinating, and yeah, and the reason I ask about those things is because we get exposed to all those different areas, and usually people teach it kind of differently. And I did, I guess, this girl in our gym, she did Graston and my knee for some stuff, and honestly, it was like super good. Like 2 weeks later, I felt massive relief. Like everything kind of went away. And it's understanding, but so what you're saying though, just to kind of like wrap up this area on like all those techniques, like they pretty much all do more of the same, which I think I've heard of like the term like tissue release or some stuff like that. They kind of like what's the purpose of all these like tools and techniques? You mentioned obviously increasing blood flow. Is it because in my mind it's like, okay, like I feel like like my immediate thought process, not knowing anything about physical therapy, is like I'm guessing there are knots and we're trying to like undo the knots, right? When there's like specific kind of, is that really what that is? Or it's more like, again, increasing blood flow, and what's kind of like the purpose? So I kind of understand a bit more of why, like literally you just like, massage people with this like tools that are sometimes like hurt a little bit in the process. That's really what I'm trying to kind of understand a little bit more.
Yeah, so really they have multiple purposes, right? I mean, I just gave you the generic approach of like increasing blood flow, because that's usually what people are using the cupping and heat for in the massage. But you can do trigger point releases too. So the trigger point is just like a top band of muscle tissue. Typically, people will have them commonly in their upper traps, right? Just because again, like the sitting posture, if they're in prolonged poor sitting posture, or if they're working out their shoulders in the gym, usually they incorporate more of their upper traps and they can't relax their neck and their head is bouncing around everywhere. So trigger point release can be as simple as like putting pressure into that area of the tight tissue, right? And then holding it for like a minute to 2 minutes and then putting them on stretch. And then they should feel like a release of those symptoms,
Hmm.
right? You can do it with the Graston tools too. Typically, you're using Graston tools to do like some type of cross friction massage, right? And that's usually for like tendonitis issue, right? Sometimes for like a sprain, like an ankle sprain or something like that. And you're just going perpendicular to the actual fibers, right? To the collagen fibers, because what it does is it helps realign the collagen fibers. And
Okay.
then you strengthen it and it helps realign them as well. So then they sit more parallel to each other. So you're not developing as much pain anymore. And
Okay.
there's studies to support that and back that up. But
Okay.
manipulation, like there's so many different theories on what it does. The research doesn't really show one exact thing. Like the biggest thing I read is that it creates like a neurophysiological cascade, it's called, where it just kind of releases all the air in that space, right? And it just kind of relaxes it immediately. And then they
Okay.
can say it increases like joint integrity, it increases like bone strength. It can help improve like your muscles. There's so many different things out there. Like I said, some of it's like, what, it really does that? And it
This is
probably
like
doesn't. But
this is like the bone cracking, right? The manipulation that you're talking
yeah,
about. Okay,
Yeah,
gotcha. Because I see some stuff on
that's
TikTok and
cracking.
like,
Yeah.
and I hear like somebody and they kind of like put like, put the sound on and stuff. And I see all that kind of stuff. And I'm sure like some people, even when you see in the comments, is like, oh, that's gonna be so bad for you. But I'm guessing obviously with proper, somebody that understands how to do it and properly do it as well. Like it's actually more beneficial than hurtful, I guess, for you. Correct?
Right. Yeah. There's certain guidelines and there's clinical prediction rules, they're called. And if a patient fits into these kind of clinical prediction rules, then typically they're a good candidate for manipulation or cracking. Um, does everyone follow that? Probably not. Right. Therapists probably run out of ideas and they're like, let me try this. And
Yeah.
sometimes it works, right? Sometimes it doesn't. But I don't think I've never heard anybody doing it. And, you would do some tests too, some screening tests before you actually do the manipulations. And I'd advise everyone who sees a chiropractor or therapist, to ask them like, we're going to do some screening before you do these tests, right? Because you can actually hurt someone pretty badly if they're in a car accident or something. They have a lot of like joint laxity or ligament
Hmm.
laxity. So they're really important to do, and it's just red flag screening.
That's awesome. Dude, this has been so helpful. Honestly, like, there's so many different things and like about physical therapy that the only information I get is typically when I go in an office and then there's 30 minutes, like typically somebody would just tell me like real quick, this is exactly what we're doing and why we're doing it, which is good. But then this is obviously kind of opens up a lot more kind of like knowledge around some of these areas. So I guess like to wrap up and just to be mindful of your time, I guess like one of the bigger things I wanted to ask you was just like what's the kind of like the main, or maybe how can people either not necessarily find you, I guess like right now, what's the recommendation when it comes down to people in terms of physical therapy, not specifically to you. We'll talk about obviously your stuff at the very end because there's a few other questions I want to ask you, but just to kind of like put a bow into all this kind of like conversations, like for people listening in, what should they take V on around physical therapy, like to get it, to not to get it, whether they're training, not training? Like, what would you recommend if you were just talking to a friend, like, hey, you should do this or you should do that because of these reasons? So people can walk away and thinking, hey, yeah, you know what? I probably need to do this, even if it's just more for correction or for simply just preventive measures, or just simply kind of stay
Mhm.
away from it until something happens, or maybe until I join a CrossFit gym type of thing.
Right. I would say before you decide to like get into CrossFit or before you decide to get into like an intensive exercise program, it's a good idea to like see a therapist, right? A physical therapist in that matter. Someone who has a lot of background around rehab, someone who probably did some personal training, or did like me, like was a strength coach, right? Because they have more of that exercise background because you don't learn a ton about exercise form and everything in PT school, right? I was lucky enough to go to a good school and have an exercise science degree where I learned more so about that and like how to progress things because I do a lot of personal training with clients after we get them out of pain. It's like a transitional program.
Mhm.
But I would say, the movement screens are the most important to kind of assess and see. Um, and people need to just be wary if they've had pain for probably longer than like a month or two, and it's with certain activities. It's probably good to see an orthopedic doctor, right, to get their take on it, just to get some imaging done, right? Because an X-ray is going to show you if there's any kind of arthritis there in the joint, right? Any kind of like bone issue going on or any inflammation. But then typically, you need an MRI to see if there's like a strain or any kind of soft tissue, like a labral tear. Um, impingement of the shoulder, you can kind of see with an X-ray a little bit. But usually you need to do 4 to 6 weeks of PT if you're going to go the insurance route to get actually covered to get an MRI. Okay.
Yeah.
Otherwise, you're paying out of pocket, which is like a crazy large amount of money.
Well,
So that's why a lot of people go into it, right? They'll go see the doctor first, right? Get the prescription, maybe get an X-ray, won't show anything. Do 4 to 6 weeks of PT where they, barely get to see their PT. They work more with the aides one-on-one, maybe 2 times a week if they're lucky. And
yep.
then, they get the MRI, then they see something's going on. So I would say, just because I know the way the healthcare field is and the insurance model goes, and I've seen the issues with it too. One thing I didn't mention before is like insurance can cut you off at any time they want. Right. So say I'm seeing you, Andres, for your shoulder, right? And you have full shoulder mobility. You've been in PT for about a month, but your strength is still, you're a little bit weak. You can't do an overhead squat yet. And your main goal is to go back to CrossFit to do overhead squats, right? And you're going to compete in like some type of tournament or competition coming up. They don't care about that. You can use your arms during the day. You can lift a coffee cup up and put it kind of above that cabinet there, or load it in the dishwasher, take it out, um, with like minimal pain. Then you're good. They're going to cut you off. Right. And
Yeah.
that doesn't make sense to me because they're just people with like a chart with normal range of motions and normal strength numbers. And if you hit those numbers, you're good. You're not going to cover you anymore. It doesn't matter what I say. I've been on the phone with these people, insurance adjusters. It's just a nightmare. It's a game like you just don't win. So I would say, if you really want to get fixed in the quickest amount of time, but also like have a good education provided to you too, which you don't get typically through the insurance model, just because the therapists don't have the time to spend with you. I would say look for like a private pay or a cash-based therapist.
Yeah.
I think that's your best and quickest route, even though you're going to spend more money.
Yeah. But
Does
it's an
that answer the
investment.
question?
Yeah, no, it does.
It
It's
is.
still
It's
an
an investment in
investment.
your body, right? No one
Yeah.
invests in their body, and that's like your most important investment,
Yeah.
right? And that's why people end up in the hospital having all these knee replacements, hip replacements. I can't tell you how many of those patients I've seen. I feel like like half of the population gets knee and hip replacements now. It's like, what did
Yeah.
they do before?
And then they could totally prevent that, which is like the bigger thing around all this. It's 100% preventable, which is kind of crazy
Exactly,
to think about. So
for
that's
sure.
all. Well, yeah,
It's just people don't know what to do.
yeah, man. I mean, that's the thing. But it's again like it's more of like the culture that we kind of that has been kind of created around here and then in the healthcare industry, which I think is a bigger problem. But at least obviously we're hopefully kind of like changing that kind of mentality around that, which I think obviously we're transitioning into that and more of a proactive and preventive type of healthcare or population rather than just being like, hey, like just fix it when it's actually broken type of thing. So but that's exactly what we're here for, which is pretty exciting. Cool, man. Well, I'm again being respectful of your time. So we'll do some rapid fire questions, and then you can tell audience and everybody listening in how they can find you, and then how they can get in touch with you. Sound good?
Yeah, sure.
Cool. Rapid fire questions are simple. The first one would be, or you probably heard them before as a listener to the podcast, but it would be, what is your favorite exercise?
Cool. Favorite exercise? That's a tough one. Let's
Rapid
see.
fire. First thing. No analyzing.
Push-ups then.
Push-ups. There you go. Oh, that's a good one. I think everybody like. Usually people say like something like deadlifts or squats and stuff like that. That's actually a pretty good one. Structural. Second question would be, what is one podcast resource you love to listen to that you like to recommend to people? And I guess like from this case, it would be more from the consumer standpoint, simply because of the fact that they're just for learning. So for a really good resource, it could be a YouTube channel, podcast, an actual, maybe an Instagram account or whatever. And you can totally shameless plug yourself on there.
So I would say probably Empire Podcast, by Bedros Koulian and Craig Ballantyne.
Nice.
That's probably like one of the ones I listen to the most, on entrepreneurialism and everything like that.
Nice. Yeah, actually, Bedros Koulian is one of my first mentors, coaches, and I've actually met Bedros in person before. Pretty cool dude. His like story is
Awesome.
kind of crazy.
Yeah, it's wild.
Yeah, the gasoline and hair story that heard a
Yeah.
million times. Cool. Second, or the third thing would be, what is one book that you would give to somebody to have in their bookshelves?
Oof. Probably How to Win Friends and Influence People.
Yeah, I love that. I've had it in the
A
back there. I
huge book.
probably read it a couple times now. Yeah,
Yeah,
that's
I
a
read
must
it like
read book.
5 times.
Yeah, love that. Cool. Last one would be, if you were stranded on a desert island and you were just could only pick one food to live off for the rest of your existence, what would that be?
Oh man, I'm gonna have to go with gnocchis. Do you know what those are?
Yeah, of course I know
Yeah.
what those are. That's the first.
Oh
I
man, I
love,
love gnocchi.
man.
Well, my grandma used to she used to roll them herself, because I come from a big Italian
Really? I
family.
was gonna say, like,
Yeah,
you're like an Italian background.
yeah. Well, my mom's 100%. My dad's German, so I guess I'm 50%, you could say. But like, I
Yeah,
grew up around my mom's family, so that's all we ate is pasta. Meatballs,
gnocchi,
sausage,
bro. Yeah, it's
lasagna.
like that's
Yeah.
delicious. It's
Oh,
extremely
so good.
filling too.
It
Yeah.
is. It is.
I love that. That's a really good one. That's awesome. Cool. Well, before we wrap it up, Corey, how can people find you? How can people find out about you? What you got going on right now? So they can kind of get connected with you in case like they want knowledge, advice, like actual physical therapy work, either online or in person. Put some plugs in there so we can kind of like put it on the show notes as well.
Yeah, so main place to find me right now is Facebook. That's where I spend the most time. I'm going to be getting into Instagram a little bit more, probably TikTok and Twitter over the next coming months now that I kind of quit my job and I'm full time on this. But Facebook, you can just find me at Corey Hoffner, right? CoreyHoffner. And then I have a private Facebook group for CrossFit where we do Facebook Lives every Tuesday, talking about like warm up routines, right? Stretching, what not to do, what to do before your workouts. We talk about like a little bit about supplements and things like that. And that's called Never Quit CrossFit. So you can find me there with like all the educational content posted throughout the week.
Awesome.
Yeah, and I'd say that's pretty much it.
Perfect. Cool. So we're gonna obviously gonna plug all those different things in there for Corey. So in case you want to, especially if you're a CrossFitter, like again, I'm huge into that community. So if you're listening to this, make sure that you kind of like go and check those resources out and join you guys know we're super huge into the private and group and communities and so forth. So that's really gonna be a really good way for you to be able to get connected on there. Corey, it was been a pleasure, man. Thank you so much for taking the time, not only for to be able to kind of come in here as a professional, but also as a client of mine who completely crushed it throughout our time kind of like here together. And yeah, man, thank you so much again for taking time out of your day to come and share your knowledge.
Of course, man. Yeah, thanks for having me. I appreciate it.
Absolutely. Well, we'll see you guys in the next episode of Nutrition Blueprint Podcast. Until the next one, see you guys soon.